those of you have a higher grade of baldness, that is grade 7, where you have lost almost all the hairs that is genetically programmed, most of these persons are very depressed because they are demotivated whenever they plan to get their hair transplant and visit any clinic. They are discouraged and demotivated by saying that they have a poor donor area and they are not an eligible candidate for a hair transplant. So in this video, I will be explaining what is the planning protocol we follow in our clinic for grade 7 baldness. Hello everyone, I am Dr. Amit Singh and I am a hair transplant surgeon based in Dehradun, and I have been doing hair transplants in Dehradun since the last 10 to 12 years. Persons who are grade 7 baldness, the protocol we follow in our clinic, that we don't discourage any patient not to undergo a hair transplant, whether he is grade 7 or lesser grade of baldness. In grade 7 baldness, where the person has lost almost all his hairs, if we plan to cover whole of the area, then he requires around 4 to 6,000 follicular units. The donor area, it varies from person to person. The donor area is called the area from the back and the sides of our scalp, which is the permanent area from where we take out the hair roots, the follicular units, and those follicular units are transplanted in the front. Depending on the person to person and the quality of the donor area, if the quality is good, a good quality is defined where the thickness of hair is also good as well as the density is also on the higher side. In those persons, we can derive around 8,000 follicular units from that donor area. And if the donor area is on the poorer side, where the hairs are thin as well as the density is also on the lesser side, up to 5 to 6,000 follicular unit can be extracted from the donor area. So, irrespective of the quality of your donor area, the quality of your hair, every person can get a hair transplant and can improve his looks. The protocol we follow in our clinic, REVERT, is as follows. As I have told you previously, there are two categories. One having a good donor area and the other person is having a poor donor area. So I will start by explaining the protocol we follow in the person who has a good donor area. If a person has a good donor area, we plan to cover whole of the bald area. The requirement is around to cover the whole of the area. The requirement is around 4,000 to 6,000 of the follicular units. In a single session of hair transplant, if we want to ensure every root should grow, that the procedure should be completed in 8 hours. In this time duration of 8 hours, 3 to 3,500 follicular unit can be transplanted in a single day session. So if we plan to cover whole of the area, we plan 2 sessions of hair transplant on 2 consecutive days, and we plan to cover whole of the area. In the first session, we transplant up to 3 to 3,500 follicular units, and the rest of the area is covered on the second day. If adequate roots are available from the scalp, we extract it from the scalp, and the extra roots, if we require, we take it from the body hair area, this beard area. We extract roots from this area and we try to cover maximum area that is gone bald. Now coming to the second case where the donor area is poor, then we explain the patient that he should not plan to cover whole of his bald area, because theoretically and practically it will not be possible to cover whole of the area, because you don't have adequate follicular units, as well as the quality of hair is also not good. So in these type of patients, the explanation is, if we want to improve your looks, the area which is at utmost priority is the frontal area, which is called hairline, and the mid scalp area. This front area, 95 to 99% of the people who are talking to you, they are able to see only this area. So our plan in these kind of patients is to give maximum hairs in the front area to give a good density in the front area. And this good density is possible in every patient, whether he has a good donor area or a poor donor area. So in these type of patients, we plan to cover the front area with good density. If we can achieve a good density in the frontal area, that the 95% of the work which is required for a hair transplant is done by covering that area only. To cover that area, around 4 to 5,000 follicular units are required, which can be extracted in every patient. So we advise him not to target his crown area, because crown area is cosmetically invisible, and if you have good density in the front, nobody will be able to make out that you have a less hair over your crown. So if you are grade 7 and are planning to get a hair transplant done, we advise you can proceed with your hair transplant. You should consult your hair transplant surgeon, get your examination done, and and discuss your plan for hair transplant. I am hopeful that the information that I have given you in this video will kind of clear certain doubts about your hair transplant in grade 7, and you can now proceed with the procedure with far more confidence. If you want further information regarding hair transplants and other hair loss treatments, you subscribe to our channel. If you have certain queries, you can post that query in the comment section, or you can direct call us or WhatsApp us on our number, the number we are displaying in this video. This is Dr. Amit Singh signing off.